Now, end-of-life care is a difficult time, and it's difficult for myself as a physician, it's difficult for families, for caregivers, and obviously for patients. And it's something we're not very good at a lot of times, and hospice is a great help. With my patients, I've never seen people, that weren't very complimentary. So tell us just simply, what is hospice?
Well, Hospice of the Bluegrass has been around for almost 40 years now. So we have a long history of working with end-of-life patients. So Hospice of the Bluegrass is very specialized. We have a team of experts that when someone is facing a 6-month or less, typically prognosis, we can come into the home, we can come into wherever a patient calls home. We come into nursing homes, hospitals, wherever that might be. And we bring a whole team that helps you and your family, the patient and the family.
Now, you mentioned team. It's not just one person. Tell me who's on the team and what they do.
Sure. Well, it's it's an expert medical professionals. They're experts in end-of-life care. There's a doctor, there's a nurse, a social worker, chaplain. We have certified nursing assistants that come in, and we even have volunteers that come and perhaps drive patients to doctor's appointments or cut their grass or whatever's needed. And we also work with the family's doctor. It's not like hospice comes in and you don't have your doctor any longer. We come in and we all work together.
Now, you mentioned cutting your grass. Now, that may sound kind of funny, but sometimes there are things at the end of life that are very hard to accomplish, and just simple things hospice can do to help.
Well, hospice really wants to come in and help the whole family, and we want to help. It like you said, it's a stressful time, and a lot of people need to have family time and think about the patient. So hospice wants to come in and take whatever we can off their shoulders. Obviously, we want to help the patient, but we want to help the whole family. We've just started a new program even that's for pets, because a lot of people are worried about their pets. So if hospice can come in and take that load off your shoulders and help walk your pet, we can send a volunteer to walk your pet or take it to the vet or whatever needs to be done, just anything like that. We build ramps for folks if they have trouble getting in and out of the house, or anything that you need, we can help with that.
So simple things like that, not to mention pain control, nausea control, sleep aid, whatever it takes to make that patient comfortable.
That is one of the things that hospice has great expert in, because we're trained in end-of-life care, so we can help with pain management. And controlling pain often helps patients live longer. There's lots of studies coming out about that. So that's one thing that hospice does very well.
Now, we used to think of hospice as cancer related.
Right.
But you don't have to have cancer to be a hospice patient.
No, in fact, anymore, only about 40% of our patients have cancer. Anything that's a serious chronic disease, we will serve that patient.
Now, is it costly? Does insurance cover it? Is it a Medicare benefit? How does that work?
Yes, all of those. Hospice is covered by Medicare, Medicaid, and most private insurances. Hospice of the Bluegrass is a nonprofit organization, so we also have some very generous donors that if you don't qualify for any of those, we don't turn anybody away for lack of being able to pay for services.
Now, you said 6 months. Is that the time? And what if it's just 6 days? Or should you be thinking longer term to call hospice to help?
That is probably one of the biggest myths out there. A lot of people think, you probably hear it, people will say, oh, they've called in hospice, and that typically means that they think that folks aren't going to live very long. What Hospice of the Bluegrass would love to have happen is, yes, if your doctor tells you you have a prognosis of 6 months or less to live, we would love for folks to choose hospice at that time, because there's so many benefits and services we can offer, and you, the patient and the family, that we can't offer if it's only like a few days left. We just don't have time to get all of those in, but we want families to have that time together, and we want it to be for the patient to be comfortable and be able to spend time with the family, and for the family to have a peaceful time, not just a crazy last minute time. So we would love for folks to start checking out hospice a little bit earlier. You know, if a patient has lots of hospital visits or has lots of uncontrolled pain, talk to their doctor, and they can even call us and we can talk to their doctor, but just there's no obligation to call and just find out if it might be helpful.
Okay, so what happens if it's not 6 months, but 7 months of all of a sudden I'm better, or at 3 months into the process, I have a miraculous recovery just because of great medical care.
Sure.
What happens with hospice then?
And that does happen. Two things could be going on. If you reach if a patient reaches the 6-month point, then they have to be recertified by a doctor. If they're still declining, then they can stay on hospice for longer than that.
Okay.
If they are better, which also does happen, they have to be discharged from hospice. Now they can always come back, but sometimes it does happen where patients are discharged.
Well, that's what we hope for.
Sure.
But from personal experience with my patients, hospice is just a great, great, great benefit.
Well, I hope so. I mean, I was telling you earlier that was true in my family, and one of the reasons I wanted to work for hospice is my mother had hospice. And I thought we just got extraordinary care. I didn't realize, I thought we were special in some way, that's the way hospice treats every single family. Every family is unique and they have special needs, and we want to come in and try to help.